now. And it is off to Dr. McKay for the introductions. Thank you.
Sounds good. Patrick, thank you. And Kelly Yarns, also the GPH coordinator, for wrangling all the details as always so capably. So I'm so pleased to introduce our speaker for this week as people kind of continue to filter into the session. We have Dr. Michelle Grocke Dewey. She holds a PhD in medical anthropology from the University of Montana and a BA in both economics and modern languages from William Smith College. She currently serves as the health and wellness specialist at Montana State University Extension and as an assistant professor in the Health and Human Development Department over there at MSU. Her research involves using anthropological methods to investigate health disparities and find practical solutions to improving health outcomes, particularly for individuals living in rural areas. Although some of her previous work took place in both Nepal and Peru, her current extension projects all strive to better the well-being and overall health outcomes of Montanans. These projects involve providing the farm and ranch community with resources to better manage their stress, working with adolescents to implement harm reduction strategies against opioid and stimulant misuse, uncovering COVID-related health outcome disparities across Montana, and creating easily accessible physical activity programs for older adults. In addition to these outreach and research projects, Michelle teaches a variety of courses on the MSU campus, including health disparities, culture and health, a global perspective, and global diseases and health. And Michelle was my PhD student once upon a time, and we're so pleased to have you with us, Michelle. It's such a treat and so fun to see a picture of Humla on the screen. So take it away.
Right, goodness, thank you so much, Kimber, and thanks everyone for organizing and inviting me to talk to you today. It was, I'll be honest, quite fun putting this together. I haven't presented on my dissertation research in a little bit, and it was, as I mentioned, really fun kind of conceptualizing how some of these impacts and this research is impacting my work now as I work with Extension and work with communities across Montana. So as Kimber mentioned, the title of my talk is Building Subjective Wellbeing Schema Among Ethnic Tibetans. All right, we'll get going. All right, so the main objective I have for everyone is to think about subjective well-being. And I have a couple of questions on this slide that I just encourage you to think about as I go along here and take us through some of the research components in Nepal. But I do ask that, I mean, I know there's not a lot of us, but if you could type in the chat box a couple of words, a couple of phrases that you think about when you think about your own subjective well-being. What's important? What pops up? And I'll just give it a minute to see. And it can be anything, just, oh, we've got a couple things, access to healthcare, exercise, happiness. If I have time to be in nature, exercise, breathe, connected relationships, so something social. Great, thank you for those of you that participated. I sleep, yes, very important. Am I eating healthy food? Sort of just posing these questions. So already in that 2 kind of seconds with just a couple of us here, I mean, we can see the amount of variance that comes up when we're talking about this type of health indicator, subjective well-being. So I just encourage everyone to think about its measurement and how we should measure it. Also, how valuable is it as a health metric? Should subjective well-being be an indicator that's considered when we implement health improvement programs, when we think about policy systems, environment change? Should it be, one of those indicators that we take into account? So just think about your own subjective well-being, think about this exercise, think about how it's measured sort of throughout the talk. I invite you to do that. Over the next 45 minutes, here's a quick outline, a couple bullets of what I'll be talking about. So I'm going to start with the overall objective of my PhD research. So I'll do this pretty quickly, but just what was I doing? What were my overall goals? Then I'm going to kind of come back and take us through a couple of examples of how well-being is measured, currently being measured. Then I'll go back to Nepal, talk about how I decided to measure well-being, and explain some of the examples of my well-being data. And then I'll end with a couple of takeaways. All right, so my dissertation research, as Kimber mentioned, took place in Nepal, in an area of Nepal called Humla. And it was a couple of years ago in 2014 and 15. And on the upper left-hand side of the screen, you see a map of where Nepal is. For those of you that aren't as familiar, you'll see it is pretty sandwiched in between two kind of large powerhouse countries, China and India. The picture on the upper right, you see there's a red circle that shows you exactly the district where I was working. And it's a district called Humla. It's quite remote. A couple of things to note is that it is not connected to the rest of the country by any roads. So it's quite difficult to get to. And as you can imagine, with that rural territory come things like, difficult access to healthcare, difficult access to education, things like that. Around the time that I did my dissertation research, there was quite a large environmental change taking place. And that is the arrival of this new road that is still being built, but had already begun being built at the time. And it was a road that was connecting some of those upper villages in Humla to markets in China. So the road kind of came down from China and was connecting those upper villages to markets where they could cart in or truck in, as you see in that picture lower right, foodstuffs, household items, things like that. And so I was very interested in this environmental change, and my research questions kind of followed. And I had two primary ones while I was there. The first one is, how is the arrival of this road impacting the health of villagers? And I know that that is very broad. And so in terms of health domains, I looked specifically at food security, diet and nutrition, and then subjective well-being, which is the focus of this talk today. And I was also curious as to whether proximity to road is or was the strongest predictor of villagers' health outcomes, or if there was something else, were there other variables at play. But really today, so I wanted to give you kind of the broad context, but really today we're going to dive into that subjective well-being piece, how I measured it, why I decided to measure it that way, and then what the outcomes of that data collection were. All right, so a couple more slides sort of broadly on my dissertation work. So here on this map, so this is a zoomed in map of Humla, and here, if you can see my cursor, you see this black dotted line, and this is the road that was being built from China across the border and into Upper Humla. And there's a couple of dots on this map that I want to explain a little bit further. And so because this was not a longitudinal study, I could not measure change over time, but I could measure differences in health outcomes between two villages. So one is village indicated by this number 2 here, a village called Gyepo, and it sits right on the road. And then the other village I spent time in is over here, number 4, Kale, which was a 3-day walk, or is a 3-day walk away from the road. And so while I was there, I really was interested in differences of these health outcomes between those two villages to be able to isolate road as a variable. Here, number 1, just to give you more background, this is where a large market is in China where goods could be purchased. And then many villagers in Nepal would purchase those goods and set up sort of a temporary market here at a town called Tumkot, where folks could go to it for easier access to purchase these goods. And then the blue dot is the capital of Humla, it's called Simikot, and you could fly there on a small plane and then walk from there to the upper area of the district. So again, I mean, methodologically speaking, this was a case control study with the village away from the road being the control village, and then the village next to the road being the case village. And I wanted to show you a couple of pictures. This is Kale, this is the village away from the road. As you notice, the topography is quite steep. The houses, as they are in this area of the world, are quite like consolidated. They build very close together. You can see that we're sort of at the start of harvest season, planting season. And in terms of what grows up here, it's quite high. It's about 12,000 feet. Barley grows really well. Bitter buckwheat grows well. Things that grow in very cold climates. The other village I spent time in is called Gyepo. This is the village that sits right on the road. So this is sort of me taking this photo. So I should mention that all the photos you'll see today are ones that I took while I was there. And right behind me, the road is sort of going by. But a couple of stark differences: the topography is flat. You'll notice that the houses are not all in one consolidated area. There's sort of a sub-village here, another one over here, and another where I'm standing. However, the villages are quite similar in a lot of other aspects. So they both are Buddhist. Villagers are Buddhist and ethnically Tibetan. Both villages lie at about 12,000 feet. They grow similar crops. They're the only two areas or villages in the area to only have one harvest season per year. And between them, there were not any significant political differences. So as hard as it is to sort of isolate these variables and pick villages that are similar when we're studying human behavior shifts, these were quite similar. And so we thought it would be good to spend time in these two to isolate the road as its own variable. A couple of other things about life in these villages. Folks are agro-pastoralist, meaning they grow crops and they raise livestock. And the type of livestock, yak is common, also a zopa, which is a cross between a cow and a yak that's common in this area of the world. And it's also worth noting that especially here in Gyepo near the road, villagers were at the time certainly becoming integrated into and dependent on this market economy, especially with that road access, having more access to that market. But those were the two that I spent time in and was studying in. And I'm not sure how many of you on the call are anthropologists, but the primary mode of data collection was participant observation. So what this entailed was really spending a lot of time in these villages, spending time with families, doing everyday tasks, just participating, kind of helping out where I could. Everyday tasks like harvesting, planting. On the right, that's the bitter buckwheat harvest. And on the left are these two kiddos that I wound up taking care of quite a bit. And I lived with their family for many weeks. So also things like helping, with childcare, market transactions, engaging with healing processes, religious ceremonies, kind of anything that day to day would take place, me being there and participating. And I think one thing to note is that it's conscious observation, right? So it's not just kind of going about your day with everyone, but really taking in what's happening, spending your evenings kind of taking notes and really digesting and synthesizing the information that was gleaned and kind of going into the next day thinking, okay, what did I not understand? What am I going to try to understand better? So that was the main data collection method. But as you'll see with each health outcome that I was interested in, I also implemented various questionnaires and surveys and those types of more quantitative methods. All right, so that's sort of part one, just a little background about my research over in Nepal. And now I want to take a step back and talk about subjective well-being a little bit. And so before I talk about how I went about creating local models of subjective well-being, I want to just provide a couple of examples of how well-being is currently being measured today in global health, public health. So most commonly, subjective well-being is measured by asking people sort of simple open-ended questions. Things like, all things considered, how satisfied are you with your life as a whole these days? Or also, some come in the form of Likert scale questions such as, taken all together, would you say you are very happy, pretty happy, not too happy? Questions like this. There are two pretty common indices of well-being or ways of quantifying it. So I wanted to bring these two up. The first one, I'm sure a lot of you are familiar with the World Health Organization's 5 well-being index, the WHO-5. This is a short self-report measure of current subjective well-being. So this one assesses how individuals have been feeling over the past 2 weeks. So for example, one of the questions on this one is, I have felt calm and relaxed. And the respondent would say, it's a frequency. So all the time, a little bit of the time, none of the time. This one has been around since 1998. It's been translated into 30 languages and it is used worldwide with children, everyone over the age of 9. So this is a great one in terms of being able to compare statistics country to country. This other one, I'm not sure how many of you are familiar, the Community Well-Being Index. This one was created in partnership. So one of the partners is ShareCare, an Atlanta-based health and wellness company in partnership with BU School of Public Health. And this one is also pretty interesting. It's less subjective in nature because it's an index with set objective variables, but it does aggregate more than 600 health risk factors into a single well-being measure. And the reason I like it is that 99.9% of US counties are included in this metric. So, I mean, that's pretty interesting, especially if we're working with rural populations across the US. So I'm not sure how many of you are from Missoula or live in Missoula, but I figured it might be the most represented county on the Zoom today. So I looked at the Community Wellbeing Index, and Montana has an average well-being index score of 56 out of 100. So I wouldn't say that's too high. That puts us at 33rd out of the 50 states. When we look at Missoula, however, it has a well-being index score of 61. So that ranks us at, or ranks you all, I'm over here in Gallatin, but 13th out of the 56 Montana counties. And there's a couple of domains where Missoula County scored higher than the national average. So that's what I wanted to point out. So one being economic security, and that was measured by community members being employed, insured, and otherwise financially stable. And again, these are self-perceptions. Housing and transportation was high. So housing values are stable, which certainly is changing over here. Public transportation is supported. And then the third domain where Missoula scored quite high is community. So if you like where you live, you feel safe, and you have pride in your community. Some other dimensions, just in case you're interested, of that CWBI are physical health, social health. They ask about food access, healthcare, resource access, and purpose, sort of meaning, what gives your life meaning and purpose. So this is just sort of two examples of indices, ways to measure subjective well-being that had existed. But when I went over to Nepal, I really wanted to ask individuals what was important to them for their subjective well-being and try to elicit some cultural understanding, some nuance as to how the road was impacting their understanding of their own subjective well-being. And so I went about quantifying and asking about subjective well-being in a very different way. And in order to do that, I used a method theory called cultural domain analysis, or CDA. And what CDA is, it was founded, it's rooted in anthropology, but it's used now quite frequently in fields of marketing, education. It is a set of methods for collecting and analyzing data about how people in certain cultural groups think about things or concepts that are related to one another. And they call those cultural domains. So cultural domains could be unhealthy foods or healthy foods, or things that you could do to treat a cold, or things people can do to help the environment. So any of these cultural domains, the idea is that if you ask enough people from that set cultural group to free list or kind of explain to you in list form what constitutes those things, you can get a pretty good idea of what the cultural group as a whole would think about said domain. So in my research, I treated SWB as a cultural domain and tried to better understand what tangible items people might think as being important, what attributes might people think are important when it comes to identifying and explaining their subjective well-being. I also thought this might be a good way to see whether or not well-being looks different in those two villages, in Gyepo and Kale, to see whether or not the road had some measurable impact on SWB. So most studies, when you use cultural domain analysis, you typically start with a free listing exercise, as I did. So you'll see my three methods on the bottom: free listing, ranking, and then quantifying the SWB. So now I'll go through each of these steps in a little bit more detail to explain exactly what I did. And when I say I really should say we. I did work with a translator and research assistant. His name is Pempa. He's amazing. He didn't grow up in either of the villages that I spent time in, but he grew up in the district. And since I did not speak Tibetan, just some Nepali, it was very helpful to have him on my team and helped me think about this, particularly for this first step. So the first step was free listing. And so we did this with a set of key informants. And so we had to somehow define that cultural domain. And so that all happened in this first step. And the key informants, the way we went about finding a group is we wanted to make sure that it was a representative group. So make sure that equal men and women were invited in the key informant group, that it spanned different wealth categories. So were households with limited resources, more resources, all included. We wanted to make sure that large households as well as small households were included. So we had 2 sets of key informants, one from each village. And we asked them this question: in your village, what does it take to be content with life? And it sounds like a simple question. It took us a very long time to come up with the exact wording and then the exact translation. And this involved a lot of back translation and a lot of getting a lot of people on board as to, what our aim was and what the correct way of saying this was. And really what we were asking people was to come up with the list. So both tangible items and attributes, things that were intangible, that they would include as being on their well-being list. And so in terms of doing this exercise, there were some times where we had to ask a probing question. For example, can you tell us more, or is that all? But we started all of these free lists with that exact question. So keep in mind, we had 2 lists now, one for Gyepo and one for Kale, and 2 different sets of key informants. So the second step was a ranking exercise. So in order to make this ranking exercise easier for people, we created cards. So that's Pempa there in the foreground. And the gentleman in the orange and blue jacket is a key informant. Those are his kids. And so now that we had the list, we created one card that had, or each part of the list was on a card. And we also had pictures on the other side of the card so people could easily sort these list items into groups and then rank them. And then Pempa would sort of read off, okay, is this how you want everything ranked? People could kind of change their minds. So it made it easier to rank a large list of items to have these cards. Also, many villagers were illiterate, so having the pictures was really, really helpful. And you'll notice that, these were actually really fun conversations, and it elicited a lot of examples and a lot of storytelling about, every move someone made with a card, saying, actually, this is more important, this is less important. Oftentimes a story came along. And so it was really, really rich ethnographic data that we got that I didn't initially think we would get while doing these exercises. All right, so once everything was ranked, every item was given a value based on the ranking. So if it was ranked number 1, it would get a higher value than if it was ranked all the way at the bottom. And these values were then averaged across all of the key informants. All right, so the third and final step was quantifying the subjective well-being. So now what we did is we had our list, we had the value. So now we went up to every single individual in the villages that we could find. And so our goal was 100%, but we ran into some issues where a lot of folks, primarily men, were out of the village, maybe trading or, off with the animals somewhere. So we heard from more women, but we got a pretty good sample size. And we asked everyone we didn't ask them the question, are you content with life, or how is your subjective well-being? We asked them, do you have every tangible item or intangible attribute on their village's list? And if there was a yes, then we multiplied that by the value that it received via the ranking exercise. And at the end of that, every individual had a score between 0, which was very low well-being, or 100, which was very high. So all of this work basically yielded this table that you see here. And I'll kind of walk you through the table, but these are the villages lists. And so here on the left, you see Kale. So this is the village away from the road. You see the rank that was given to all of these, to the indicators. So you see Kale has 17 items, and here's Gyepo over here has 12 items. So you see the ranking, you see the actual indicator, and then you see the percent of individuals that actually possess this item or attribute. So on the top of the list, so in Kale, away from the road, have access to education was the item that was most important. Though, notice that only 13% of individuals said that they had access to education, so it's quite low. In Gepo, the number one was have time for religious practice. And there you see 76% of villagers were able, or at least say that they are able to have adequate time for religious practice. So I first wanted to look at similarities between these lists. And so one category of items pertain to individual character attributes such as kindness and positive thoughts. And we see that across both lists. So you see are kind to others, have calm thoughts, calm mind, can take things lightly. So that's away from the road. Similarly, not by the road, you see things like have kind and positive thoughts, are friendly with all people. So this is one category that we see regardless of the road being there or not, this is consistent. Second similarity is the strength of social ties and family. Many people considered family attributes, strong family connections to be very important. And you see that up here on these lists. So in Kale, have family members who get along, have a family. Over in Gepo, have households where all members cooperate, have a chance to live with family members. So first we'll kind of go through these similarities and then we'll look at some differences. But again, to highlight the strength in familial ties and also those attributes, character attributes such as kindness pops up in both. I'm going to start a new list here because there was a lot of circles and I don't want everyone to get confused. So looking at the same list, now I want to highlight some differences. So if we look at Gepo, the list or the village by the road, you start to see some things like savings. And this was really interesting. And it really was further elaborated upon with interviews that I was able to do with households, saying that savings, the presence of savings really means that you are either able to or about to be able to engage with the road, with the market economy soon. And so for people, this was so important, whether or not they could save. And if you think about it, this community hasn't been engaging with currency for all that long. And so to very quickly kind of go through this globalization process, now have access to a road, and then all of a sudden be talking about savings and engaging with this road in this way. So that came up, and those stories came up a lot when we talked about this list. The second thing I want to draw your attention, well, I guess real quick with savings, only 24% of individuals were able to save, even though it was number 3 on the list. Also, something that appeared was able to have tasty foods. So this, many people were pointing to an array of Chinese things like chocolate, candy, soda, even alcohol as being sort of tasty and having this luxury prestige mark stamped to them. And we're explaining to us that now that they're by the road, the ability to have those things is really important for well-being. Though there was also a lot of mention to the fact that if a household couldn't afford it or didn't have it, they were keenly aware of the fact that they couldn't have those things when other households could. And so you really start to see, or what I noticed is wealth inequity, just inequity in general. And that also comes out with some of the indicators that we see on the list for the village near the road. 2 other ones are not greedy, content with what you have. So that came up as, now there's access to so many things, not all families can have them. So it's important that we be content with what we have. That came up with some families, and then are able to avoid quarrels. So I definitely saw and listened to and heard a lot more kind of intra-village fighting and just bickering, things like that, largely having to do with market access and which families were able to take advantage of the fact that the road went right through their village. All right, so now that we've seen the list, we've kind of looked a little bit at similarities and differences. I wanted to share with you a little bit of data that we were able to pull together from this exercise. Certainly don't have time to go through all of it, but I have 2 slides here that I thought we could talk about. The first one is subjective well-being attainment in Kale, away from the road, and Gepo on the road. And here you see the mean, minimum, and maximum levels of SWB. So just something fun that we can do now that SWB has been quantified based on these local EMIC understandings. So you see that the mean is actually quite similar. I mean, not all that different, 67 away from the road, 74 on the road. But the data indicates that the range of scores over here, there's a higher variance, there's a higher range. With some families or some individuals having 100% SWB attainment. And since I was, intricately involved with all these families, I know who these families were, or these individuals. And so the two that scored 100 were two individuals from families that own trucks. And we're able to really capitalize on that road. And so it's almost become a bit of a monopoly. I mean, it was at the time. I realize years have gone by. But at that time, there were only two families that owned trucks, and both of them happened to find themselves up here at 100. So just some things to point out here when we're looking more aggregately at this indicator. So another thing we did with the data that was fun and allowed for some further analysis was we averaged the individual scores across the household, and that gave us a household variable as well. So we could basically have household subjective well-being in addition to individual well-being. And so that brings me to my next slide, where I wanted to share with you household well-being based on an interesting indicator, or one that I thought was interesting, and that was able-bodied persons in the household. So one thing I learned quickly while I was there is that on average, homely workers work 13 hours per day. And often this is really arduous manual labor, tending to the fields, working with the animals, working on the homes, many things that involve a lot of caloric expenditure and are high stress. And so I was curious whether or not having more or less able-bodied persons in the house would somehow be correlated to subjective well-being. And the results are pretty interesting because it doesn't go up the more able-bodied persons you have in the house, as you might expect, or certainly what I expected. So if we look at this, we see that, these are single head of households doing this by yourself. They actually have a higher average subjective well-being than those that have two people. And so this is the explanation I'm about to tell you came from me kind of doing some digging and figuring out why, and people telling me stories and sharing examples. So throughout both villages, if there were households that had one person, single head of household, everybody knew who those people were. There were small villages, very strong social connections. And so people would help that person. They would help them harvest their crops. They would provide them greenhouse yields. They would tend to them if they were ill or needed something. These people were quite well taken care of by the community. Now, 45% of the households found themselves in the second category with two able-bodied people. So that was the majority of households. So those were the ones that had so much to do, but their situation wasn't all that unique from their neighbors. So no one was really running over to lend a helping hand. And so you see how that can explain a little bit of decrease in subjective well-being. Now, when we go up and we have 3-4 able-bodied members in the household, you see the well-being exponentially increase. Another interesting fact about this area of the world is that traditionally the marriage patterns are different than ours in the US. Traditionally, they practiced a form of polygamy called polyandry. So that's where a woman marries a band of brothers in this case, or more than one man. And there are many reasons for this, especially in this harsh environment. So things like livelihood diversification. If a family had more than one husband, one husband could tend to the fields, one could tend to the animals, one could engage in trade. So it was actually really beneficial for that reason, also for land tenure, passing land to the next generation. So it had a lot of benefits, but I also was very intrigued to see that some of those households that practiced that traditional marriage pattern commented and found themselves having higher subjective well-being because of that. So I just encourage us to also think about what this means in our context here in the US. I mean, most families are nuclear families, maybe one or two able-bodied sort of head of households with X amount of children. And I know that that is starting to shift, right? There's starting to be kind of a wave of, different household patterns, communal living, things like that. And I mean, I'm just posing a question, but how does the household setup relate to SWB? It certainly had a relationship here in Homeland.
Michelle, I'm just going to pop in and alert you to 5-minute warning.
Perfect. All right, I have 2 takeaway slides. And so the way that I kind of organize these takeaways is, one is sort of takeaways I had reflecting back on my work in Nepal. And then the second takeaway slide is kind of how I have taken some of this insight and used it to inform my work here in Montana with my current extension position. So my main couple of takeaways, the first is these locally constructed models of subjective well-being provided immense insight, more than I thought they would when I started. One is providing a lot of insight into existing and changing, I have with exclamation mark, cultural values. So learning that, social ties, family ties, having more than one, able-bodied person, the value of education, just doing this exercise provided a lot of insight into that. Also, it illuminated a lot of health inequities. And back to the first slide, when I sort of posed the question, should subjective well-being be included when we're looking at lowering health disparities? It certainly illuminated a lot of health inequities in my work in home law, and elicited a lot of conversation and example as to, why people didn't feel as happy. Things were changing, and what indicators they didn't have, or items they didn't think they could get, and how that really impacted their mental health, their emotional health. Also, it provided me some insight into this idea of globalization. I mean, this research really was like studying fast track globalization, how this road could come in so quick and change things. And I certainly, with this bullet, what I wanted to make sure is that we don't leave, or I don't leave, making it sound like this road was all bad. I mean, definitely not the case. This road brought access to healthcare. This road made it easy for pregnant women to get to care they needed, deliver at a birthing center. It made it easier for kids to walk to school. So many things were really improved, but there were also some things to consider in terms of heightened inequities that the well-being lists and exercises illuminated. The second piece here is another big takeaway, is just the importance of sharing the findings back with the communities. I spent a while kind of when we scribbled down with number 2 pencil and came up with everybody's well-being score. We talked to everyone in the households and shared the data back. And that was illuminating both for Pemba and I and for all the households. And so that's something that working in public health here at MSU Extension always try to do, and sort of remember the value of that sort of end of the process there. People were able to reflect on the data, comment on the gathered data. And so that certainly helped with public health outreach efforts in home law, when I could share that data as well with local NGOs that were working there. And then lastly, for everyone on the call that works in global health, public health, at least where my mind goes is, having done this exercise, these villages were so far away from Bozeman, Montana, yet quite close together, and yet they had completely different, or very different, well-being lists. And so what about our communities in rural Montana? They might think really differently as to their subjective well-being, what it actually means. There's many environmental changes, political changes, climate changes, all these things happening across our state. And it begs at least me to ask myself the question, are these indices with predetermined SWB variables like that community well-being index, are they relevant for all research contexts? Or are there some points in time where it makes sense to ask the community, what's important for you for well-being, and measure it that way? And so I'll leave everyone with this last question, which I find myself thinking about a lot. What added value can a local understanding of SWB bring? Thank you.
Thanks, Michelle. That was, as always, such a treat to listen to, and to revisit home law in a way by looking at your pictures. So people on the call will probably know that this is the same district that I did my own dissertation research in, and is the subject of my sabbatical research coming up next year. So I'm gonna see if anybody wants to turn their video on and ask a question of Michelle while we still have her with us. Questions can also be put into the chat, and maybe While people are mulling that over, Michelle, I was wondering, I have a couple of questions. One is, can you talk a little bit about the sample size in the two villages relative to the population size in those villages?
Yeah, and it's funny, I debated putting in some comments on sample size and statistical significance into the talk, and given the 40 minutes, I didn't. But when we did the third step, so when we asked everybody as to their, whether they possess the items or the attributes, we got about 80% response. So again, we heard from mainly women, and we heard from a lot of that middle generation was missing. And so the N was very low, but it was representative, right? Because there was only 32 and 36 households in the villages respectively. So, I mean, it does sort of beg this like methodological question, right? The N is low, but there aren't that many people in the villages. So, I mean, that was sort of an interesting, I wouldn't say dilemma, but something that we had to think about while doing the research, and then especially while sharing the results. But I will say that it has led me to think about it, statistical significance and being able to say that is great, but also I know it has sort of real implications for the communities and the villages as a whole. But hopefully that answers your question. So we got a lot of representation, but still with a low end because the populations are low.
Yeah, thanks. And I remember that. I just wasn't sure if other folks on the call would know that about your research. So thanks for explaining that. My other question is, you'll probably remember Helena Norberg Hodge's work, Learning from Ladakh, and one of the findings there. So for people who aren't familiar with the region, Ladakh is a similar topography and culture and so forth, but over the border into India, and also known as Little Tibet. So very similar to this place. So one of the things that she found was that when roads came into Ladakh, that in villages where she had worked extensively pre-road and pre the arrival of tourists and the market economy and outside goods and things like that, people didn't perceive that they were lacking in any significant way. They had relatively good food security. There was relative equity across the villages in that region. And then when the road came, the tourists came, like a decade later, she went back and asked a lot of the same questions, and people were like, we're so poor. The very same households that 10 years previous had said, we're doing really well, we do well here, we can feed ourselves, we have happiness, da, da, da. So I'm wondering is that one of the take homes for you that you might reflect upon, that with the arrival of the road, there was also the arrival of a sense of want or of goods that were previously unknown, or increasing inequity? What's the big picture in your mind?
Yeah, I mean, very much so. I mean, it really drove home the idea for me that there is a notable difference between absolute wealth and relative wealth, and absolute resource attainment and relative. And you could see it in Kale, the village away from the road. They had less when you looked at metal roofs or number of yak, or they had less, but everybody had similar to everybody else. So in terms of their own mind and how that resource attainment equated then or yielded, let's say, feelings of purpose or subjective well-being, it didn't really impact it as much, right? Because you didn't look at your neighbor and say, oh, I have this, but they have all of this. In Gepo, you started to see that, where a couple of people were able to capitalize on the road, and they really took off, and it left that other person no different, but in terms of the range and in terms of that relativity to that person that was able to capitalize much farther away.
Yeah.
I didn't mention this because of the time, but I did the same exact method as I explained today for socioeconomic status, because I didn't, it wasn't really a currency economy until very recently, and still there were so many other things involved. And so those lists, those SES lists, are kind of very telling to Kimber, your question right now, in terms of what appears on Gepo's list for SES and what appears on Kale's list. Mm-hmm. But yeah, very much similar. And I would love to go back and ask these questions again and see how it's changed, and see whether that issue of relative wealth has gotten greater.
Mm-hmm. Thanks, Michelle. I saw Gil's mic was on for a sec. Did I jump ahead of you with a question, Gil?
Yeah, pretty much, but that's okay. Hi, Michelle. It's so nice of you to take your time to give us this presentation today, and that there's so much in it. It's really rich and impressive, and I think there's a lot of things here, especially for grad students who are out there. I mean, thinking about how you might use this type of methodology in your own work. I think Michelle gives you some really great ideas here and a really great model about using participant observation and those sorts of methodologies. And I'm wondering a lot of things, Michelle. I guess I'll just ask, there's often this sort of, this comparison or tension or debate between focusing on more subjective measures of health versus more objective measures. And I was wondering if you might comment on that in terms of this work. Do you have any sense of how so-called subjective measures of health, how those differentials between your two sites might differ in terms of things like, basically, mortality, morbidity data, disease data, birth rates, fertility rates, and infant mortality rates, and those sorts of measures, and how that compares to the subjective measures that you explored.
Yeah, thanks, Gil. That's two great questions, if I can dissect that. So the first question was sort of commenting on subjective versus objective measures of health and their value. I think reflecting back on this, they're both important. I think objective measures like that community well-being index, the value there is that we can compare. If everything is a subjective measure, it makes it really hard to compare over time. It makes it really hard to compare, at one point in time, across countries. So I think reflecting back on this research has basically cemented sort of in my mind that they're both needed, right? We can't just rely on these objective measures. These subjective measures need to somehow be included. But to your second point, I wish I would have done more with that. I didn't gather data regarding, let's say, trips to the hospital, sick days, chronic disease of these individuals. I wish I had, and I wish I would have compared that to how they felt, their subjective well-being. There was much less physical health metrics on those lists than I thought. If you go back and look at them, it's much more family support, one's outlook on life. I think just that fact alone makes it interesting. But I didn't do that, and I wish I would have, and I wish at some point in the future I will have a chance of maybe doing this in Montana, and then comparing it to some of those objective health indicators you measured. But yeah, there'd be a lot of value in that. So thanks for the question. And I should add that Gil and Kimber were both on my PhD committee. And so a lot of the thoughts about methods was certainly, yes, as a team, and they were my fabulous mentors.
Especially me.
That goes without saying. Michelle, we have a couple questions in the chat for you. One comes from our PhD student over here in public health, Chelsea Kuiper. Chelsea, do you want to just turn your mic on and ask your question while we still have Michelle with us? Or almost up against time, and people might have to start jumping off, Michelle. But if you don't mind staying.
Oh, I'm fine. Yes, we can talk about this for a while.
Sure, thanks. Sorry to hit up right against time. That was such a fascinating talk. I really enjoyed it. Thanks. I was just wondering about the role of language and kind of how that intersects with these well-being concepts, and just thinking about any differences you might have seen between the Nepali language and the Tibetan language, or comparing that in ways that we think and talk about well-being in English. And the role of language in shaping the specific aspects of life that we tend to focus on when we talk about well-being?
Such a good question. I mean, I can't stress enough how important language is and choice of words. And I think that, I mean, for me, not speaking Tibetan, so all the villagers in both villages speak Tibetan, homely Tibetan, which is a specific dialect. And so we decided, we went back and forth and asked it in that way. And I think had we reached a slightly different way of asking it, it would have elicited different responses. So I think in this case, you know, presenting the data and saying, these are the lists, that couldn't have happened without both the direct translations of English and Tibetan, what we asked people to think about, and then what they responded in turn. I mean, even when I look at the different ways, the well-being index from the WHO, for example, I mean, that asks people, I felt calm and relaxed, right? Their choice of words so much dictates how people are going to think about it and respond. We have numerous well-being indices across the US, and they all ask it in a slightly different way. So even if it's objective and we can say it's comparable, unless it's the same index asked the same way, I don't think you can compare it. Because I mean, especially when we talk about our feelings, our satisfaction with life, our happiness, like those three things are already yielding slightly different thought processes. So I think it's a great question. And the only thing I really have to add is, if I were to ever do this again, or if you know, just to be really transparent about how the question was asked, so that the reader knows exactly what the question was and how it was translated. But great question.
Thank you. A really fascinating response too.
So Michelle, we have a comment from one of our faculty members. Annie Sondag's still on the call, I think. Do you want to turn your mic on?
Yes.
Hey, Annie.
And hi, Kimber. Michelle, that was an awesome presentation, just fascinating. You know, I've been thinking about subjective well-being for a long time and how to measure it. And I just love the way that you looked at that through a cultural lens. I'm wondering if you, and you may have already said this, but have you used those methods here in the US, in Montana, or anywhere else?
No, I would love to. I have thought about, and it might be in part because, so I work as the health and wellness specialist for MSU Extension. And so a lot of the work I do is needs-based, and we have so many health inequities and needs happening. So I'm working on an opioid prevention project, a physical activity for older adults, and farm stress, because those were pressing needs and are. But not to say I wouldn't love to do this and ask people, even in different communities around our state, even sub-communities. So I would love to know, you know, what a third generation Montana rancher versus, you know, said other subgroup, what those lists would look like. So I like your idea of, you know, looking at opposite ends of the wealth gap. I mean, we can objectively measure that here, and then subjectively measure what would go into those. So I would love to do that. And I think now that I've been in this role 3 years, so I sort of have my bearings. So maybe I will have time soon.
Another project. Great. Thank you so much, Michelle.
Sure.
And Michelle, I'm still hopeful that we might be able to enlist our PhD student, Courtney Gerard, who's working on the lived experience of pregnancy, labor, and delivery in rural and remote Montana communities. Still interested in seeing if we can get her to work some with your schema and modify them for those communities. So you and I are definitely on the same wavelength there. So we'll have to keep talking. But I know we have other graduate students that are also interested in this, as reflected partly in Annie's question and some of her community health students as well. So we'll have to keep talking. And I think we're out of time here. We're up against 5 to the hour. And I just wanted to thank you again for joining us and for sharing your subject with us and your analyses and your wisdom. Thank you.
Thanks so much for having me.
Thanks, Michelle. Great to see you.
Bye, everybody. Have a great day.
Just to remind people that the seminar series is obviously ongoing. We're going to meet again next Monday at 2, and we're having another of our global public health minor steering committee members, Angela Luis from the wildlife program here at UM, join us to talk about her research on biodiversity, zoonotic disease risk, and using hantavirus as a case study. So she's going to be talking about that next week. And I look forward to seeing you all there. Okay, that's it for now. Bye, everybody. Thank you so much.